Our sympathetic nervous system is also known as our fight or flight response. So that is where we are releasing those stress hormones, and we are figuring out, do we need to fight or do we need to flee from whatever it is that is causing the spike in the stress hormones? So if we were in labor in the woods and there was some sort of predator like a cougar or something in the woods, and we could sense that it was around, we know baby is safe in here, but we don't know if baby is safe out here right now because we sense that there's a threat and there's some sort of danger out there. So our sympathetic nervous system shuts down a lot of the oxygen flow that's going to our reproductive organs and to our digestive systems, and redirects it to our extremities and the thinking part of our brain, the neocortex, so that we can decide what we need to do about this threat, and everything else can wait, including labor. So if you're feeling stress and you're having those stress hormones spike, your body is going, there's a threat somewhere out here. Baby isn't safe out here. I'm going to keep baby in here instead. And wait until you feel more relaxed in order for labor to resume. So when we talk about failure to progress, horrible term, that we will be going a lot more in depth into different videos in this course, we talk about psychological factors and how psychological factors can really come into play in failure to progress or a stalled labor or a labor that's coming in slower. And it has been shown that psychological factors can be a cause of failure to progress, whereas some care providers might assume that it's another physical reason, like baby not fitting in the pelvis. And so the World Health Organization is realizing that a lot of cesarean sections are being suggested too early, when it could be psychological factors that are causing the slow or stalled labor. And so it's really important to have the support that you need, give birth in a place that you feel safe with care providers that you trust, and minimize unnecessary interruptions so that your body and your hormones can flow in the way that they are supposed to, and you can minimize the stress hormones as much as possible. So you may want to make sure you have a good relationship with the people who are taking care of you so that they can help have your oxytocin and your beta endorphins flowing as much as possible so that you don't go into your fight or flight response, which can